Hi, I'm Dr. Jamie West. Do you want to know how to fix your neck pain once and for all? You need one of these. This is called a Denneroll. So one of the common problems that I see when we get patients that have tried everything else, they've tried Advil, they've tried hot and cold packs, they've tried massage, they've tried physical therapy, they've tried other chiropractors. The one key that I see that's lacking is no one has addressed the curve in their neck. So we've talked about the curve that we should have in our neck. It's called a lordosis. So that means that it curves that way. So if kind of like a backward C. So if I look at someone and I see the whole of their ear, compare it with their shoulder, it should be no more than 0.59 inches forward. That's looking from the outside. When I look on the inside and I take an x-ray, I should see that the first vertebra and the last vertebra pretty much line up straight, and then we should see a curve forward from that. The bones should be nice and square, the disc spaces in between should be nice and open, and then the hole right behind that should be open because that's where the nerves exit. If that structure is not there, then I know that we have a problem. 99.9% of the time when I look at a neck x-ray, there's a problem there because the curve hasn't been fixed. I can adjust a patient all day until the cows come home. We can do a ton of therapy, but if they don't fix the curve in their neck, we're going to always be revisiting this problem. So the best way that we found to fix this, and one that works, we can prove it on pre and post x-rays for getting that curve back in, is this little guy called a Denneroll. This is ours from home and we've used it for years. I think one of my kids has poked holes in the bottom of it. But what it does is it's designed by a company called Chiropractic Biophysics, and what they've done is they've taken this piece of foam and they've measured the spine and they've applied it to this piece of foam. So what you do is you lay on this, and there's a whole protocol that we use with patients, and it actually restores the curve in the neck. And I always tell patients, this little guy, it may stink laying on it in the beginning. It may not feel good. That's because your neck is going the opposite way of this curve. This is the curve that it should be in your neck. But the more that you lay on it, the better it's going to feel. I have patients that lay on it when they have a headache because it helps it go away. Because what does it do? It helps all of those postural muscles relax. It gets those bones going the right way that they should. And then I tell them, this guy's going to be your friend for life. You're going to use it every day. You're going to take it with you when you travel. You're going to keep it out where you can see it. Keep it on your entertainment center, on your nightstand, because you're going to use him every day. Because if you don't, your curve is going to go back and you're going to have nursing home posture, or you're going to have that big hump in your back. Because ladies, we don't want that hump. We don't want to look like the hunchback of Notre Dame because our posture is so far forward. But once we fix that posture, we fix that curve in the neck, then we start to see a nice flat back, just like we want, a beautiful back. So this is one way that we use to fix a curve. It fixes it great. It's proven before and after on x-ray. If you know someone with nursing home posture that looks like a hunchback, send this to them as a clue and they can come see me and we will fix that thing.